Welcome to Theba Time, where I discuss thoughtful tools, resources, and shared experiences to help and encourage caregivers of loved ones living with dementia. Good afternoon, David Cook.
Good afternoon, Theba. It's great to be with you again.
David's getting used to a new setup. I've moved into our dining room, and so it's new. It's different.
Yeah, but it's good, different. I like it.
So our podcast today is going to be about the nuts and the bolts of what David does on behalf of every caregiver out there. And first and foremost, I'm going to let you know that David is with Alzheimer's Association, Arkansas chapter. He is the Director of Public Policy, and you've had a busy week.
It's been a busy couple of weeks. It feels like it's been a fast year. It's hard to believe that we're already in December, sitting here close to the holidays.
Yeah, and what David and I like to do is visit about kind of what was some successes and what are some challenges for 2023 and just a snapshot of what's going to happen in 2024, God willing, right? But just recently, I want to kick it off because I know I just saw a news report of you, and you were presenting an annual report to the Arkansas Public Health Committee and just sharing about the health crisis that is Alzheimer's and how it affects caregivers. So kick us off there.
Sure. So this week we were able to present to the Joint Public Health Committee, and we, that the point of that presentation was to deliver an annual report on the status of the implementation of the Alzheimer's and Dementia State Plan, which we've shared before was adopted by the state in October of 2022. So every year, because of some of the things we've put in place, we are required to make this report just to ensure that the legislature knows what's happening, but more importantly, that they understand the status of implementation, and also to give them some recommendations to look at as they go into their business in 2024. So this year's report really highlighted the historic legislative successes that we saw here in Arkansas during the 2023 legislative session. As we've reported before, we saw a lot of traction, a lot of movement, and we did have a lot of success to help strengthen, dementia training standards across care settings. We also were successful to get the Department of Human Services to continue to fund the Alzheimer's and Dementia Caregiver Respite Grant Program that I know that you have benefited from personally, and some of your listeners have as well. And then we were able to do something that was very significant for Arkansas by establishing a dedicated position within the Department of Human Services called the Dementia Services Coordinator. And so we highlighted some of these legislative victories and went into detail on what that means in terms of the status of implementation. And it's important to note that all of these policy wins were consistent with the recommendations that we put forth in the Alzheimer's and Dementia State Disease Plan.
That's a lot. You do a lot.
It seems like a lot, yes. It is a lot.
It's a lot of important details because David meets with legislators, senators, every which way up at the Capitol, in his office, in their offices, trying to get them to understand the needs for Alzheimer's, dementia. And we should note that it's not just policy stuff for David. He has a personal reason. Explain a little bit about that.
Yeah, I was asked this yesterday, so thank you for bringing it up. It's just a powerful reminder that this is more than a job for me. It's very personal. Having lost my grandmother to the disease in the 90s, when as caregivers we didn't know much about the disease, and because of that, there were very limited support services. So I still think about my grandmother and the challenges that we faced as caregivers. But now, fast forward 20 years, we are entering the phases again. My father has been diagnosed with cardiovascular disease with mild cognitive impairment, so vascular dementia. So he is in the beginning stages of that. So now we're navigating the caregiving duties and going through the challenges that come along with those.
Give us
diagnoses.
because I know for people setting out, my dad had dementia Lewy body. Definitely a bizarre part of that dementia, how it affected his motor skills and brought on the Parkinson-like symptoms. But explain a little bit about vascular. Like if someone at home was trying to figure out what kind of maybe their parent is entering into, give us some details about that.
Sure. So cardiovascular dementia is usually experienced by people who, as the name suggests, have poor vascular issues. They may have, just a family history of cardiovascular disease. They may have, maybe they've had a stent placed in. It's very common amongst patients who have diabetes, which is what my dad has. And so his diabetes, along with, which of course, limited blood flow. And so he had cardiovascular disease that actually has caused him to lose a couple toes because of the poor circulation. And earlier this year, he had a stent placed in. So it's very consistent with just, poor operation or restricted operation of the vascular system, which makes sense because that means, blood is not pumping effectively to the brain. And so that limits the oxygen and, of course, causes the dementia. And so
how about communication, or is he able to communicate with you? Because I know there's some forms of dementia where they can't speak.
Yeah, so Dad's in the early stages, so he communicates too well at times.
Good one.
But he's still very active in these early stages. We're very fortunate that he's fairly independent. We do, if my mom has to get away, we do seek respite services just to ensure that someone is there. So what we're seeing over the last year, what I've specifically noticed, and we talked about this to his provider a couple weeks ago, is we're starting to see more cognitive decline, and so more issues with his memory in terms of asking like what day it is or why we are doing a certain activity.
One moment, David, as we didn't. Yes, Mother.
Oh, never mind.
Yeah, we're recording, Mom.
Never mind.
Now she is verbal too. All right. I'm going to put this on pause unless, Mama, we're recording.
You want one?
We're recording in here. Did you see that? So if on YouTube you're able to see my mother react. Anyway, we'll talk to you afterwards. So I wasn't giggling at what you were talking about with your father, but this is pretty much what happens during my podcast is, it's at my home.
Yeah,
So
which is great.
I care for my mom, and she's part of my life, and it's never an oops. It's just a reminder to her because, she'll forget here in about 5 minutes and probably come back. But she's doing good, everyone. But let's get back to you and just what David was explaining was most of us don't really hear about that term of vascular dementia. People just really sometimes just throw out, oh, he's got dementia or she has dementia or Alzheimer's. But we also know that there's different complexities to the disease, and so they have certain labels.
Yeah, and with every sort of dementia, you're going to see a slight variation in the symptoms. Cognitive decline is consistent with...
Yes, ma'am. We're recording, Mama.
So cognitive decline is of course consistent with all dementias, but with certain types of dementia, you see different symptoms. I think you mentioned dementia with Lewy bodies. Frontal temporal dementia is one where you see a lot of hallucinations, sometimes seeing or hearing voices that aren't there. That's really not consistent with what we're seeing with my father, but that's just kind of some different symptoms with every.
That.
Yeah.
Hallucinations, very fascinating.
Yeah.
And it's got to be spooky for them. Before I understood that hallucinations were a part of what my father's dementia was or had or particulars.
Right.
I always wondered why he would look over and just stare at things. He was seeing things,
Yeah.
but he wouldn't tell me. Finally, he told me one time he saw a cat, and then there were bugs on the ceiling. So it got more creative when my brother was here taking care of him. He saw a rainforest in the kitchen. So, but I would go and sit with him, and I would look over, and he was just staring. And I just
Yeah.
always wondered what was going on in his mind. And I also know that they know something's going on. So sometimes when they know a loved one's with them, they won't say anything.
Yeah. But I think you made a great point that it's scary. It's a new experience, and not really know or not having a space where you can process that can be very difficult. Of course, that's speaking from the outside, never experiencing it myself, but I can imagine that would be terrifying, just trying to figure out, because you don't really have the capacity to process what's happening, right? And so that puts an added layer of fear and uncertainty. And
Right.
yeah,
Yeah, wow. It just, and that is why, folks, we talk about, get your own stuff together emotionally.
yeah.
Hold on a minute. I'm going to have to put this on pause and find out what.
We'll be right back, folks.
Okay, we're back. What did you just say? Your favorite part about coming over here
It's
is
being
what?
able to spend time with your mom, and just. I think I've come over here much. She still recognizes me, and
Yeah.
so that's great to have interaction.
And
Always
we-
love to joke.
And we get to enjoy her antics. Like, I
Yes.
had to pause because she was in the refrigerator, and she doesn't really know why. But really, it's not because she's hungry. It's because she wants our attention.
Okay. Yes.
So why else would she just make a noise? Like,
Yeah.
This is our third interruption, but that's okay because it's cute.
It's great.
Now, what was that?
I don't know.
Folks, it's all right. So what's funny about this podcast is I told David that the yard man had left. The mailman had just made a clankling noise before we started and delivered the mail. And I don't think I'm having an Amazon delivery anytime soon. So I told him it would be probably peaceful and not noisy. And we've had our third delightful
Yes.
interruption by my
It
precious
is
mother.
welcome. So
And she likes it when guys are over here. Now, I just call you guy, but
Yeah.
you're a guy.
yeah.
You are a guy. Because I have so many of my girlfriends come over to visit. So it's a big deal. So she's like, in a weird way, kind of flirting. She
Yes.
loves having guys in the house. So anyway, here we go. We are getting back focused now. I'm not promising you there won't be another interruption because I'm pretty sure there will be because we have two cats that all of a sudden want my attention too. And then they'll get her attention, and then we're going to hear the door chime go open up, in and out, in and out. So, whew.
It's just.
But it's part of it, right?
It is part of it. Correct. Yeah.
And and having the podcast here gives a real element to the fact that I can tell my mom that we're recording, but she really doesn't understand. And I can put a sign up that we're recording, but she doesn't get it. And that's okay. So it's just cute.
Yeah. Yeah.
She's feeling a little bit feisty today. All right, so we hit upon some particulars. David was talking about his father's vascular dementia and what that looked like. And I just wanted to touch on David because he does a lot of just nuts and bolts, sitting down, talking to politicians. But I have him on at least twice a year, and it's important to know that he does have a personal connection to this disease. And I wanted you to know that, and he doesn't mind sharing about it either. All right, so David, we normally start the year out with what your intentions are, policies, etc. And what we do is try to paint a picture of what the year is going to look like for Arkansas, and how the Alzheimer's Association is going to go forth with some policy changes or whatever it might be. And then we end the year. And so we are here in December. And what were some successes for you?
They I still have to pinch myself. I think we had a really successful legislative session as we led off with 6 pieces of legislation that we worked and got through the session in the governor's first year. And based on what we have been able to see, that is historic for Arkansas, given that the 6 pieces were focused specifically on dementia. Certainly historic for me and my personal career to be able to work 6 pieces of legislation and get them all the way through the process without a single no vote in committee and on the House and Senate floor. So that's a testament to not me and my work, but it's really a testament to the advocates who show up and share their stories that allows us to build a foundation that we can advance policy off of. And so when I look back on the year, I think what's significant for Arkansas, one, I would be remiss if I didn't mention that we do have now for professional home caregivers, they have to complete dementia-specific training, and Arkansas becomes the first state in the country to actually mandate that for the home care space, which is good.
Now that is a big congratulations, and the reason I say that is because when my father, he passed away in 2019, but we started home care for him through a company in 2018, 24/7. And it was difficult to get a caregiver, to hire a caregiver that had an understanding of the disease. And I think that's just across the board with any institution that provides. When you say that was like, it's not just one institution, there's several different caregiving institutions out there, companies, I should say, that provide caregivers. And so towards the end, we were blessed that we had a young lady who was so sweet and patient, but it was shocking for her with my dad because he had some absolutely bizarre behavior.
Yeah.
And they, some of them had the experience, and so they could walk with Dad through it, and they were patient and they understood, but she did not. She was fresh into it, so that's a great thing to hear.
Yeah, and the home care space specifically, most of those companies experience very high rates of turnover. And when you do exit interviews and you talk to people who leave the healthcare space, one of the reasons they leave is because they do not feel adequately prepared to meet the needs of their clients. And as we see more and more people developing dementia, it was important for us that the providers and those that are providing care had some basic understanding of the disease. We also wanted them to learn how to identify and navigate the behaviors that you were mentioning, but also communication strategies and how to talk to someone with Alzheimer's dementia. You can't, as you may or may not know, you can't all the time reason with someone with Alzheimer's. Certainly some of the behaviors are not logical. You certainly can't win an argument, right? And so,
Absolutely not.
And so being able to communicate and understand their perspective is really essential. But we've always argued that if you train folks, you're going to minimize that turnover. People are going to feel prepared. And I think what is also encouraging to see these different providers at the different levels of care, so both on the long-term care side, assisted living, and now the home care providers, all of them receiving basic dementia training. With the workforce shortages that we're seeing, what would happen if someone came in as an entry-level home care provider, fell in love with caring for people with Alzheimer's dementia, and decided that they want to continue in the geriatric space? That's really what we want to see. But so the dementia training, I think, was really essential. It's good to see assisted living communities respond and support that new regulation. And we're hearing from providers across the state. During the process and even now as we get ready to implement that, who are thankful and grateful, and some of them were already doing some great things in the space. So this kind of captured those who may not have had this as a part of their training. But we did this to make sure that the staff were prepared to address the unique needs of individuals with Alzheimer's. One of the other categories that we're proud of is Arkansas became one of 12 states to adopt legislation that requires members of law enforcement and first responders.
Yes, I was hoping hoping you'd bring that up
to have
because I was
Alzheimer's
so
and dementia.
excited to hear that.
And, we know that law enforcement have frequent engagement with individuals with dementia, and most often they engage with their families at a time of crisis. Most of the time they're called in situations of wondering. But when they engage with someone with dementia and Alzheimer's, even through a routine traffic stop, those can get very confrontational. So it's important for us to prepare our law enforcement in de-escalation tactics and how to communicate effectively, but also recognize dementia-related behaviors, because a lot of times those kind of get lumped in with mental health, but it's very different. And so trying to ensure that our members of law enforcement can safely de-escalate situations, not only for the safety of the patient, but for the safety of our officers as well. And so we're excited about that and the opportunities it's going to continue to create for not only our state police, but also our municipal officers who previously did not have any training. So this is very exciting for us. And I think the fourth piece, which is really essential, and it says a lot to the way that the state has chosen to respond to Alzheimer's dementia. We were able to establish that critical personnel inside the Department of Human Services. So the Dementia Services Coordinator, they will ensure that the excuse me, I'm so sorry. I tried to fight it off.
That's all right. Between you and Mom, I hear her back there just a sneezing.
So the coordinator will ensure that the state agencies are coordinating their responses to Alzheimer's and dementia, which will in turn save the state money, making sure that we're not duplicating our efforts. But another role that I think they'll play, and that's why it's exciting to see them housed within the Department of Human Services, is that they'll take a look at our aging services and make sure that they are inclusive of the unique needs of individuals with dementia. How do we increase those support services? And how do we reach the people that still are grossly underserved because they live in a rural area,
Yeah,
they're
good
not in
point.
the metros? And so as that position gets filled and begins to become implemented, we look forward to continue working with the agency to help support their work as well. And so that's a huge piece. I think a huge win for Arkansas. Probably of the six, one of the most significant pieces, because it's an infrastructure piece. So what that means is now we've got someone, in the state agency staff that's only focused on our disease, which creates opportunities for us to do more education, but it also is great for the people that we serve, which is more important, making sure that our folks are getting the services and access to the things that they need.
And the other success, which was a success prior to 2023, was the respite grant.
Yeah.
And I bring that up because, let me tell you, since I started now, of course, my dad's disease and he could financially afford it. Back in the day was not as expensive, and we're talking about 2019, 18
Right.
and 19. And I thought it was expensive then. Well, now we're 4 or 5 years later, and it is a lot more expensive. So the reason that I just sat down with a caregiving service is just to be ready. I see a potential problem here. I'm going to hit stop for a minute. We're going to run into another podcast that I forgot to delete. Be right with you, folks. Okay, we're back. Some little technical thing. So it's expensive. Now, what I do, I'm a very proactive person. I went ahead and set up with the same company that I used for Dad. And I'm always thinking of emergencies. And the emergency that I'm always wondering about, or maybe worried about, is what if something happened to me? What if I broke my leg, or what if I had heart issues and had to go into the hospital? I wanted to go ahead and have a file set up at this company so that when my friend calls, hey, we're going to need a caregiver for the next couple of days, Theba's in the hospital, that's taken care of. Mm-hmm. So again, I don't have any other family members that live nearby, so that's something to keep in mind. You might sign up with a caregiver service, and that's smart. And But also you need to know, because it's not as if this wasn't a surprise, but it was a reminder that since COVID, there are less workers out there in absolutely every institution. And the caregiving service is the same. So you are going to have to be patient, understand. Most of these services, these companies, do a fantastic job of trying to supply you with a caregiver for a certain day or hours. But we're not talking about robots. We're talking about human beings that may not show up, or they may not have the staff. So be prepared for that as well. And that's across the board, as we all have heard on the news.
Staffing shortages everywhere, and there are some companies who have shared with us that they have clients they can't serve because of the staffing, so they have to be creative and bring in sometimes temporary staff to fill those roles, which I think brings up a really interesting point, that what we're learning is more and more families are choosing to age in place at home. And so the demands in that space are only going to be exasperated over the next couple of years as we see a rise in the prevalence of the cases of dementia across the state. So to say that concerns me is an understatement. Having enough people to provide care, not just in the home-based side, but across the care settings, hospitals, ALFs, the assisted livings, and the skilled nursing facilities and long-term care, all of them are fighting for bodies, and sometimes there's just not enough bodies going around. So it's really encouraging to see you be so proactive and have that care plan in place just in case something happens to you. You have to always plan for the unexpected, right?
And so, part of your care plan may not be a hired gun, meaning that I have to have cataract surgery, which is not a big deal. But it's going to be a situation where I'm not going to feel comfortable. What you need to understand is if you're with a caregiving company, there's a minimum of like 4 hours. Sometimes, 4 hours is usually the minimum.
Right.
And this past week, I went for my checkup for my eye, and it was just an hour and a half. And so a friend came and stayed with Mom. So I didn't need a 4-hour caregiver at that point. And so part of the whole point of that example is that your friends want you to ask. That's what I've learned. It is very difficult you put yourself in a losing situation, in a stressful situation, if you don't attempt. So I've got a pool of friends, and I know the ones that will and the ones that won't. I've got friends who are retired, and they're people that my mom is familiar with. So that's part of the plan. So I've already set up for January when I do have the cataract surgery, which is not going to be a big deal, hour and a half probably max. But I'll need somebody to drive me, and I'll have someone come sit with her. And it's already on the calendar. I have 2 friends that are going to take care of that. So I did that as well for them. I don't want to always. There are going to be times, emergencies, where you're like, oh my gosh, can you come over? I've got to go do this or something. And you can call them. But for them, too, I wanted to honor them. And they want to say yes, and so it's on their calendar. Yeah. Something might come up for them, but it's on their calendar. It won't be a last-minute thing, but you will have people you need to call and feel comfortable calling for last-minute stuff. Just recently, my mom tweaked her back, and I couldn't figure out what on earth. I'm sure it was bending over petting the cats. Nevertheless, she needed a lot more of my attention around the house, and I was not comfortable even going outside. Raking leaves, because I wanted to make sure she got to the bathroom and back. We had to get a walker, and I leaned on friends to be available. I let them know what was going on. Of course, they said, let me know what I can do to help. Trust that. If these are good friends, trust that if they say that, they mean it. And so I had them in my hands if I needed them, and so we started this caregiving conversation with the fact that it is expensive. It's a lot more expensive than when I had to hire for my dad. So we brought up a success was the respite grant that I think has been so successful. There shouldn't be any reason it would stop, right?
No,
You have to ask for it every year.
we do go back to the well and continue to ask for it. In 2024, we are up against a budget session. So in Arkansas state politics, in even years, the legislature meets for 30 to 45 days, and all they do is decide the budget. And so during those years, which we're coming up on one, that's where we focus our attention on budget ask. And so not every family, as you clearly pointed out, can afford the private pay. So the respite grant was essential. We had some respite programs, but those were spread amongst the disability population and the aging population. And so our folks were competing. I would hate to say that we're competing, but there's only so much dollars to go around. So we did carve this out for those individual families who may make too much money to qualify for state assistance, but not enough to be able to afford private pay. And so this respite grant program is designed to meet those needs, to capture the folks that, quite honestly, they fall through the cracks. And it's specific to our dementia caregivers. Right now, the funding level is set at $200,000. We are asking the state to match the $200,000 with an additional $200,000 to get us to $400,000. Because what we've learned the last couple years, we are in the second year of our pilot, or it's an official program. It's not a pilot now, but we're in the second year of our program, and here we are sitting in December. So we've had 6 months of the award period out. The funding's been available for 6 months, and we're close to 75% of the funds already gone. So that means we have 25% of the funds to last us. So roughly around $60,000 to last us till June 30th. So someone asked me yesterday if $200,000 was enough. Clearly, the answer is no. We think the funding level needs to be around $500,000. So we're going to try to continue to work incrementally to get it to where it needs to be.
Yeah, and we always want to mention the respite grant as much as possible when we're doing this podcast because it's for Arkansas.
Yes.
And we worry a lot for the rural areas that don't have this information or think it's complicated. It is not complicated. I did it a couple of years ago when I had to go to my class reunion. And it was easy. Usually people think when you have to sign up for certain things, it's very convoluted. It was not. And so we want to make sure we get that word out. We want you also to get that word out if you're listening to this to other people who are in a caregiving space and they need rest. And obviously, they encourage the respite grant to be for you, to recharge you, to get away. But we also know that we live in the real world, and that's not as possible. So sometimes people use that for getting their own doctor appointments done and running errands and so forth. So as much as we love to encourage that you take care of yourself and you use that to get away, we know it's not used that way a lot, and that's okay.
And we accessed respite for my dad so that my mom could go to a doctor's appointment and not have to worry about her caregiving duties at the time and really focus on taking care of herself. That worries me about my mom because she is such a giving person, but you can kind of see the stress of being a caregiver start to weigh on her. But, and so often because you spend so much time providing care, and as the disease progresses or you come into a situation that you're experiencing with your mom, now she has back pain, so that increases the likelihood of a fall risk.
Yeah.
So you have to, be extra careful because you don't want to get further down the road, right? And so
Absolutely. So you
it's-
end
it's
up
the little
stepping up
things.
your game. I mean, I'm making
Yeah.
sure, even though she can brush her teeth and she can still get dressed, I'm in there.
Yes.
I'm making sure that she doesn't trip on her britches when she's putting them on, because the goal at that point is, even though she can get around, it's Ginger, and I want to keep her out of the hospital.
Yes.
So the night that she hurt her back was a absolutely sleepless night for me, because I was like, oh my gosh, how's she going to get in and out of bed? So every time I heard her, I jumped up. I was there so that she could get back and forth to the restroom. And what's very interesting, because we're talking about Alzheimer's, so she had no idea what was wrong with her. I mean, even though she was walking all weird and crooked and looked like she was in a lot of pain, she didn't say she was in pain. She was just awkwardly uncomfortable, which made it risky for getting in and out
Right.
of the bathroom. And so we are looking to find out what kind of back issues she has now that she's not in any kind of discomfort and she can walk. But the thing is, she keeps forgetting why we're going to the doctor. I hurt my back. These are things like you don't forget if you. So,
Yeah.
And she goes, well, how? And I said, well, I'm not. And so I go through it again with her. She wants to know why I have a walker in the house. Now, when she first hurt her back, she loved the walker because she knew she was,
Yeah.
something was off. And but I stayed with her because we're talking about introducing. I always want to make sure I mention this. You cannot teach an Alzheimer's patient new things. They are not in the learning phase. They're not, even though they may act like children and toddlers, they cannot learn. Don't expect them to learn. So as many times as I showed her the proper way to use the walker so that she could be safer,
Yeah.
she pushed it like a grocery cart. It was hilarious, but it still made me nervous. So I was
Yeah.
with her every step of the way. But then at the same time, I was so glad she didn't let pride get in the way, and she used it. It gave me some comfort. Something else that I did quickly, and I had a couple things already from Dad, so I didn't have to jump the gun on a lot of stuff for her easement. So, but I did order a toilet riser, and sorry. It's funny how all of a sudden the cats are very important. It's really just Mom. She wants to open and shut the door. And in a minute, she's going to ask another question. And it'll be about the cats, I'm sure. But I already had a toilet riser, but it was really not efficient. It was old,
Yeah.
and I needed one with some arms. So I got on Amazon and ordered one. I already had a chair for the shower from my dad, so I got that down. Got some handlebars already for another toilet that she uses, and then got a riser not as tall for that. That's the daytime potty. But so I had some stuff already, and so I just want to encourage people, because when you have things don't sometimes happen gradually. When you have somebody who hurts their back. And you don't have to be an Alzheimer's patient. When your back goes out, you are crippled for however long that inflammation. Yeah. So the good news about the walker is I had it close by. My friend delivered it right away. It's one that I used for my dad. So I got that done. So at that point, you're just quickly shifting and maneuvering and doing what you can to make sure you got some stuff in place. And I know that now these are things that were loaned to me by a friend. So you might want to go ahead and let some of your friends know who might have some of these items so that you are not in a situation where you're panicking and having to order something. I'm going to hit stop one more time, and it's not because of Mother. I'm about to crash into another podcast. I didn't realize I
There we go.
All right, we're back. And again, I'm not going to blame this interruption on Mama. But she was about to interrupt again, well, wasn't she?
I think
she likes to peek her head in.
I think she's getting close.
And so what I want to encourage you guys to do is put the word out, whether it's on a Facebook group. Have some stuff that you know that you can call on and get right away. Again, with a back situation, there was no wait until 5 days from now to get a walker. So these are things that, the toilet risers, as much as I wish I'd had one at home already that was sufficient, that is something I had to order. So I really stayed with her because,
Yeah.
it's just once your back goes down, it goes down. So
Yeah. And
do
I'm
you
getting
have
at
a resource that
the age where if I
Yeah.
sneeze, my back could go out. And
Yeah. Well, and I've been thinking about this a lot because I don't have a strong lower back. I've always had disc problems, and now I am in a position of where I'm having to kind of maneuver her, or I have to be very careful.
Yeah.
Because I can't go down in my back.
Right.
And even, I know it sounds silly, but I just don't bend over very well. And so I'm having to get down on the floor to help her put on her pants and her jammies and stuff. And I sound like I'm 100 years old when I get up off the floor. But so that's in mind, and it's in mind a lot more when you realize that you have to keep yourself as healthy as possible. Because the whole time I was wondering, like, gosh, if I have to pick her up off the floor or help her off the floor, what is this going to look like?
Well, family caregivers don't have sick days. Like there's no calling in. Like I can't make it today. It's 24-hour care, and as the disease progresses, so does the need for more interventions. Which, to your point, takes a physical toll on your body, but emotionally as well, as those become more intimate interventions, helping with toiletry or getting dressed and things like that, taking a bath. They're emotionally draining, but very physically draining as well. And so my mom is retired, but I do think about that with her, because if something happens to her and she goes down, now I'm put into, the primary caregiver role, and
you have a family.
and I've got professional obligations and work too many hours a week to mention, but I do think about it. It's always in the back of my mind, like if because like you, my brother lives away. He doesn't live close. We do have some support services. I know who I could call, but I do think about that a lot. Like, oh man, if anything ever happens to her, it's
right.
Yeah. But when that time comes, we figure it out. We always do. And I just hope that it doesn't come. So.
Right. And it brought up
Yeah.
something else it wasn't because there was an incident, or maybe there was. It might have been the back. So when she was down in her back and I wasn't sure the next day, which would have been a Sunday, whether I was going to be calling for an ambulance to come take her, I just, while she was resting and she was not in pain, I began to understand that I need to have a checklist, and I put a checklist together of things I would need if I had to go with her quickly somewhere, like the hospital. And so I also put together a overnight bag, because obviously we're both would be overnight, because I would be there too. So it just sometimes, we want to encourage you to be proactive on these fronts, but sometimes it takes an incident where you're like, oh, wow, I need to, because I'm going to be rattled. I was rattled that night. Better that morning when I realized that she was better. I mean, not as in much pain and discomfort, and her ability to get off the bed and in the bed was sketchy. I'm going to be rattled. And I was. I mean, I couldn't sleep all night, and then I thought, well, okay, then I might have to do this and I might have to do that. So I did put a checklist together of things I would grab. And then again, I always have a friend that's nearby that has a key to the house, because we have 2 cats. So I would call her eventually, and she knows the lay of the land. She knows absolutely everything about our house and where important things are. So I have that already covered, but it was just like, gosh, if I had to go with her right now tonight to the emergency room, am I ready?
Right.
Do I have my own toiletries? I'm going to grab my computer. I'm going to grab my phone. So these are the things I put on the list. I need a cord. Last thing I'm going to do is run around to the nurse's station going, my phone's dead.
Yeah.
Paperwork, power of attorney, whatever. So I put all that together just to cut down on the stress of the moment, because with Alzheimer's patients, unlike the last time that she hurt her back and had to go to the hospital, and this was like 30-something years ago, I was like, I'll see you there. No,
Yeah.
they will not understand, and I will need to be with her every step of the way.
Yeah.
Well, we heard some really good news, David, and I know that you're not taking the credit for that, but you do a lot of the heavy lifting, the meeting. You're always so good about explaining a very technical process of meeting with legislators and laws, et cetera, and all the things that have to be done, and he's doing it on our behalf. And he's doing it on his behalf because he has a personal connection to the disease. But just know what David is doing with the staff of Alzheimer's Association is for you. And they have a 24/7 call hotline that you can call not only for quick help, but to ask questions. So please take advantage of that. What we are going to do is we'll have David back. When do you start meeting with? Is it usually in February or?
Well, it's
Different.
so in January this year, the Arkansas State Legislative Session won't begin until sometime in March.
That's right.
Because we have a presidential primary election this year, which happens on March the 5th. We don't care who you vote for, but get out to vote. So please register. If you're not, check your voter registration. But some candidates have primary opponents, so they're out campaigning. So they've extended or delayed the session until after the primaries are over on March 5th. Then we'll put forth our budget ask. There's a lot of things that we're working on, but the two main things is, again, just trying to get more funding for the respite program. We also are asking for a public health investment on, just basic risk reduction. How do we minimize our risk for developing dementia, but also the importance of early detection and diagnosis now that we are in an era of treatments where there are some treatments available for people who are in the early stages of Alzheimer's or mild cognitive impairment. So in order to get those treatments, you have to have a diagnosis. So early detection diagnosis is critical for those folks. So we are asking the public health department to get engaged on this issue. We've been pushing them that direction for the last several years, and they have done some things. They've responded. We just need more engagement in that space because education around Alzheimer's and dementia is critical. We need to normalize the conversation around brain health in the way that we've done it around mental health because, as you know, there's still such a stigma attached to our disease. So having podcasts like this and sharing what you share on social media personally has empowered me to stop making excuses for my dad, to share more about my own personal story. It's almost like seeing you proactively do that gave me the permission and the confidence to not feel like when I'm in a social setting, particularly, and Dad's behaviors get a little awkward, I don't have to apologize for him. If Dad had a broken arm, I wouldn't say, I'm sorry, he can't do that. He's got a broken arm. We just understand that. But it's with these. My point is we need to normalize the conversation around brain health the same way that we do about mental health. Right now, you don't shame anybody for having mental health. We openly talk about it. We need to do the same thing around brain health because there are some things we can do. And our point has been all along, I'm going to get a little passionate here, Theba, but all along, if you invest in risk reduction and you invest in education and preventative measures early, you are ultimately going to save money in higher cost of care on the back end. So the state's going to spend the money. It's just whether or not you want to be proactive or reactive. And so much of what we do in state politics is reactive. And that's frustrating for lobbyists like myself. We wait till the problem's already here and then try to scramble to find the money to solve it. When there are some proactive measures we can take, the same way you've been proactive in terms of preparedness for the emergency that might come, that you never know might come, right? But politically, our vision is sometimes narrowed to what's right in front of us. We really need to be a little bit more proactive because there's some things that we can do that might decrease prevalence, which will save everybody money, right? And so I just get tired of some state agencies and lawmakers kicking cans down the road because the Alzheimer's crisis is happening now. We can't wait anymore, and we aren't going to wait. We've had some successes, but what that success does for us is realize that we've established a strong foundation that we need to continue to build on. So just for your listeners, for you, and a motivation for myself, just know that we're not letting our foot off the pedal. We're going to continue to accelerate and move the state in the direction that we know it can be, because I know Arkansas can do better for our folks, and that's what I think about every single day. Thank you for coming to my TED Talk.
I love that passion. I love it. Thank you for being that way. Thank you so much for joining us today.
Thank you for having me. It's wonderful to be in your home and
Now
to
you
just
get to
share
hang
this
out and
time.
talk
So
to Mom.
now we get to hang out and have some fellowship time.
All right, folks, we love caregivers. We want to be there for you. So please reach out to Alzheimer's Association, Arkansas Alzheimer's, wherever you are. I know that not everyone who's listening to this lives in Arkansas, but there are associations everywhere. Get educated. It will empower you. Thank you.